Natasha and Andrew. Take a seat.
Hey.
How have you guys been?
Good, how are you?
I've been fine. Why do you look so tense, Nandu?
I'm a bit worried that Vasha might be falling pregnant. And she's also tried using birth control, like medication stuff, but she reacts to them a bit too much. And so I just don't want to take any risk of her falling pregnant. Honestly, we can't afford having a child right now. And even if she did fall pregnant, we'd have to consider abortion. And that's just way too costly, and it's also against our morals and ethics.
That's true. Not only that, but there are also multiple immediate physical risks such as pelvic infection, injuries to reproductive organs and heavy bleeding. Emotional and psychological side effects are more common than physical ones, and these can range from guilt or regret to severe depression.
Oh my god, I had no idea about all this. See, this is why we need you. What do you think we should do next?
Don't worry, I have a few options for you. I would recommend implantable drug delivery devices, hormonal IUD in particular. These release a controlled dosage of medication to a patient over a long period of time. The hormonal IUD is a small device made of plastic that releases a hormone inside the uterus. The only hormonal IUD available in Australia is the Mirena, which releases a proestrogen hormone called levonorgestrel.
Whoa! How does it work?
The hormonal IUD is an implantable drug delivery device that prevents pregnancy. Pregnancy starts with the follicular phase, where an egg cell is grown inside a follicle in the ovary. This is part of the menstrual cycle. During this phase, the lining of the uterus is also regrown after having been shed in the previous phase, menstruation. When the egg is fully developed, it is released in the phase called ovulation. If, within this 24-hour period, sperm cells enter the fallopian tubes, a process called fertilization can occur where the two join to form a zygote. This continues to develop and implants into the thick lining of the uterus, resulting in pregnancy. A hormonal IUD stops this process in 3 ways, through the release of a hormone called progestin. This hormone can stop the process of ovulation, thickens the mucus of the cervix, making it harder for sperm to pass through, and, if somehow a sperm cell is able to enter and fertilize an egg cell, the hormone causes the lining of the uterus to thin, preventing the fertilized egg from implanting and thus preventing pregnancy.
Wow, this sounds great.
Sure does, but there must be some disadvantages to it.
Yes, definitely. There are advantages and disadvantages to this device. The risks are minimal, but there are chances of infection when inserting the IUD. There are side effects such as acne, headaches, breast tenderness, nausea, mood changes, loss of libido, and weight gain. IUDs have one of the longest lasting contraceptive effects, lasting up to 5 years. It can easily be removed and also reduces period, bleeding, and pain, making it a win-win situation. The IUD is also more cost-effective as despite higher initial cost, it requires minimal maintenance and does not need to be replaced as frequently. But don't worry, there are future developments. I have a video explaining them. Here, let me show you.
Hi there. It's great to hear that you're planning for the future and considering a contraceptive device. Hormonal IUD devices such as the Mirena have been available on the market for almost 2 decades. It is an old, proven and reliable technology that is in widespread use in many countries. For these reasons, I think it is unlikely that there will be many significant future changes made to these particular products. However, there are exciting prospects for other devices such as a contraceptive implant. The contraceptive implant is a small rod around the size of a matchstick, and it contains a type of progestin hormone. It is implanted into the subcutaneous tissue in a patient's arm. These have been increasingly popular amongst young adults as they are known to decrease acne, and the installation process is relatively non-invasive compared to that of a hormonal IUD. In future, these devices have the potential to integrate with modern technology. Future contraceptive implants may be equipped with a microchip. This could allow the contraceptive device to be remotely controlled using a smartphone app, for an example. This would yield many benefits, one being that it will be possible to switch on the device when it is needed and switch it off again instead of removing it completely, in case the individual would like to try for a pregnancy. It would also be possible to fine-tune hormone dosages to cater for individuals and different body types. Many current implanted drug delivery systems contain a finite amount of medication, so they need to be replaced after some time. However, some new drug delivery devices are being developed with ports which allow for transcutaneous refills once the initial medication is depleted. This feature would be ideal for a smart contraceptive implant with a microchip because it would greatly increase the lifespan of the device and reduce the associated costs. Potentially, future contraceptive devices could have many more functions, including calibration, an on-off switch, and an increased lifespan. Of course, this technology would present a new set of risks. If it were possible to hack into these devices or there were vulnerabilities in the app software, the consequences could be devastating. A company that is at the forefront of implantable drug delivery technology is Microchip's Biotech, based in the US. They have developed a microchip implant that is activated by a wireless signal to deliver a specific dosage of medicine up to 1 milligrams. This device has been used in a successful clinical trial to deliver a synthetic parathyroid hormone to treat women with osteoporosis. The company has plans to develop this technology to treat diabetes, multiple sclerosis, and for women's contraception. They plan to release their products onto the market in the near future. With smart implanted devices such as the cochlear implant already in widespread use, there is a proven market for these implantable devices, and it is likely that the general public would be accepting of the idea of a contraceptive microchip implant in the future.
Okay, so seems like it's pretty safe, but the most important question, how much is it?
It's approximately $680 if you have Medicare and $40 if you don't.
Okay, sounds great. We'll book our next appointment to look into this further. Thank you.
Sounds great. Let me walk you back.
See you later.